Mr. President, we are soon to be debating the future of Obamacare. Now, the American people have told us that they want Congress to repeal this so-called health care law. They've told us to start over with real health care reform. This actually shouldn't be a very controversial vote. It's clear, even to the law's supporters, that the Obama health care law has not worked out in any way that they had specifically expected. The Obama health care law is collapsing, whether the president wants to admit it or not. Democrats really should be eager to join us to help fix the damage that's been done by this law. So far, they've been much more focused on protecting President Obama's legacy than on protecting the American people and the health of the American people from Obamacare. Last month, President Obama did a radio show in which he was asked about the law and about problems with the law because people all across the country are seeing significant problems with the law. The president would not admit to a single problem with this law. He insisted, he said, it's been a success. Well, I go home to Wyoming every weekend. I'm a doctor, practiced medicine in Wyoming for 25 years, and the people who I talk to, my patients, my neighbors, people all around the state, people I run into in my travels, they do not consider Obamacare a success. Now, Democrats come to the floor and they say it's okay that insurance rates are rising. Remember, the president said they'd go down by $2,500 per family. It's okay, the Democrats say, that insurance rates are rising because they say the rates always went up before the law. But what they won't tell you is that premiums aren't just going up a little. They're going up a lot next year. Actually, they're going through the roof. Now, that was a study by the McKinsey Center for U.S. Health Systems Reform. They found that the median increase for the bronze plan from this year to next year. That's just the average. That means for half of the people, they're going to pay more than that. For the silver plans, it's up 11%, platinum 12%, gold 15%. These are double-digit price increases. These are not a success. Democrats have come to the floor and talked about some of the people who've gotten insurance coverage since the law took effect. What they won't tell you is that having insurance coverage is not the same thing as getting medical care. The New York Times ran an article about 2 weeks ago with a headline, "Many say high deductibles make their health law insurance all but useless." They don't even call it health insurance. They call it health law insurance because it's insurance to comply with a law, not to actually give you health care. I mean, it's astonishing. Even the New York Times, health law insurance. The article tells the story about David Rhines from Jefferson Township, New Jersey, 60 years old, has a history of chronic knee pain. This man says that his $3,000 deductible makes it impossible, he says, to actually go to a doctor. He says, we have insurance, health law insurance, not health insurance. We have insurance, he said, we can't afford to use it. President Obama, this is not a success. Democrats who support the health care law say that it created these marketplaces where people can shop for insurance. What they won't tell you is that companies have been pulling out of the marketplaces, pulling out of the exchanges all across the country. More than half of the state co-ops have gone out of business, have failed. The largest health insurance company in America says that it may drop out of the program entirely next year. In Wyoming, there's just one company participating in the Obamacare exchange. That's the choice on the Wyoming exchange. One. Does President Obama consider that a success? Democrats say that a lot of people like their insurance plans. Well, they won't tell you about the Gallup poll last month that found the American people are far from happy. Just 33% of Americans said that the health care coverage in this country is either excellent or good. 1 out of 3. Only 1 out of 5 are satisfied with the total cost of their health care. Now, both of these numbers are worse than they were when President Obama took office. Say, how are you doing now compared to where you were when Barack Obama went to the White House? People will tell you when it comes to health care, it is worse. Another survey last month by the Kaiser Family Foundation found that just 38% of Americans have a favorable opinion of the health care law. Is that the way President Obama measures success? Is that what he calls a success? Why won't the Democrats come to the floor and talk about these surveys? Democrats come down to the floor and say that Obamacare has put millions of people on Medicaid. I'm not sure how many of them have a full understanding of Medicaid. As a doctor who practiced medicine for 24 years, I can tell you a lot about Medicaid. They won't say anything about what a failed program. They won't admit to the fact that Medicaid is a failed program. A new study last month found that cancer patients with Medicaid in California, cancer patients in California, we have 2 senators from California who voted for this law. Medicaid in California patients with cancer are less likely to get recommended treatment, and they have a lower survival rate than people with other types of insurance. The Democrats celebrate the fact that they have all these new people on Medicaid. This is not a success. Democrats don't want to talk about any of this. Now, nobody on this side of the aisle is denying that there are people who have been helped by the health care law. Why won't any Democrat come to the floor of the United States Senate and admit that for every person who has benefited, someone else may have been harmed, may have suffered? Why won't Democrats admit, why won't the President admit that the law has not lived up to his promises? Why did we need a 2,000-page law that upended the entire health care system in this country to basically expand the broken Medicaid program? None of this had to happen. None of this is what people were asking for when Democrats wrote their law behind closed doors back there. Certainly not what people are asking for today. This health care law has been expensive, disruptive, and devastating. It is headed for collapse, and if Democrats won't admit it, then they're just kidding themselves. Republicans are ready to move on with a better approach. We will work to lower costs and make insurance affordable for all Americans. We will make sure that people who need insurance can actually get usable insurance. That means making coverage equal care. That's what it should do. Coverage ought to equal care. We will give people freedom, flexibility, and choice to allow patients to make the decisions that are best for them and their family, not Washington and President Obama telling them what's best for them and their family, those people making those decisions for themselves. We'll protect consumers by making insurance predictable and stable so people don't have to switch their coverage and their doctor every year. Finally, we're going to fix Washington by making Medicare and Medicaid stronger for people who absolutely rely on these programs. You know, President Obama and Democrats in Congress do have a choice. They can join with Republicans in accepting the inevitable. They can act now to reform our health care system in a way that works, or they can stand by and watch as the wheels continue to come off of Obamacare. The program is collapsing. It's unavoidable. Congress should not allow this health care law to harm the American people for one day longer. Democrats should work with us to create a replacement that actually delivers care, not just unusable coverage. Thank you, Mr. President. I yield the floor.